Good afternoon to one and all gathered here. It gives me immense pleasure to warmly welcome you all to this important observation of Drug Awareness Day organized by the School of Commerce and Management Studies at Dayananda Sagar University. Drug use remains one of the most pressing issues in today's society. It can lead to severe physical and mental health consequences, including addiction, irreversible organ damage, and in many cases, fatal overdose. Beyond individual health, drug abuse is often linked to increased accidents, criminal activity, and emotional and financial damages within families and communities. I also take this opportunity to introduce our Dean, Captain A. Nagaraj Subbarao, who is instrumental in conducting this event. Captain A. Nagaraj Subbarao is the Dean of the School of Commerce and Sir, I kindly request our Dean, sir, to speak a few words about drug abuse.
I think we've got experts, so we'll move on to that. Yeah?
Yes, sir. So let us extend a warm welcome to our guests, Dr. Venkata Lakshmi Narasimha and Dr. Aishwariya Jha from NIMHANS, Bangalore. Dr. Narasimha works as Assistant Professor, Center for Addiction Medicine, Department of Psychiatry at National Institute of Medical Health and Neuroscience, Bangalore. With a focus on addiction psychiatry, he has completed his MD, PDF, DM in addiction psychiatry from NIMHANS, Bangalore, and International Society of Addiction Medicine certification in addiction medicine from ISAM, Canada. He has been involved in the care and management of individuals with substance use disorders, behavioral addictions, and comorbid psychiatric conditions, severe striving to provide compassionate and evidence-based treatment. In addition to clinical work, Dr. Narasimha has contributed to research in addiction medicine with publications in peer-reviewed journals. He has published 62 research papers, and his H-index and total citations are 13 and 862 respectively. He has got the Best Researcher Award 2023 and the Best Research Grant Award 2023. Dr. Narasimha remains committed to community outreach, participating in initiatives to raise awareness on mental health issues and the prevention of substance use disorders. Welcome to Dayananda Sagar University, sir. We also have another distinguished guest amongst us, Dr. Aishwariya Jha. Dr. Aishwariya is the senior resident at the Center of Addiction Medicine Department of Psychiatry at the National Institute of Medical Health and Neuroscience, Bangalore. She completed her medical undergraduate from BGS Global Institute of Medical Sciences, Bangalore, and MD Psychiatry, DM Scholar in Addiction Medicine from NIMHANS, Bangalore. Dr. Aishwariya has significantly contributed to research in addiction medicine and has published 12 research papers, and she has 3 and 21 H-index and citations respectively. She is a gold medalist in psychiatry, Dr. DLN Murthy Raf Memorial Prize for the Best Outgoing Student in MD Psychiatry 2021, National Institute of Medical Health and Neurosciences. She also won the Young Investigator Award 2021, awardee in the World Federation of Biological Psychiatry Conference, and the Best Psychiatry Award 2022. A warm welcome to you also, ma'am. I kindly request the speakers of the day to give their speeches. Yeah, good question. No, not this one. No, sir, sir. It's there. Just change it. This one, no?
Good afternoon, everyone. It's a post-lunch session. Let's get some high knowing about addiction. Let me start with the story of a boy who is the boy who I have seen, like Aishwariya is currently doing her DM final year. So when I was in my DM first year, so someone has called me and told that nothing your case, mother is a doctor, and the boy has some problem with heroin. Can you please help? Uh, so then the boy has come. So initially, when the boy came, I think he was around 17, 18 years. So at the age of 16 years, like I think your age group might be somewhere 17 to 20. Can correct me, 20 plus. Okay, so although the biological adolescence that we talk about is from 12 to 20, still the brain continues to mature till 25. So this story might be also relevant to you. So he came with at the age of 16. He was doing all well. He was in a big metro and he was studying his 11th class. Then he tried on cannabis. So he was using cannabis on and off, on and off. He was getting a lot of pleasure using cannabis, but his education was going on. I hope all of you know what is cannabis. Which local name is ganja, right? So then suddenly, when he was in 12, his father was diagnosed with cancer, and his father passed away within 3 months of diagnosis. So then mother took him to a place where there is easy access to heroin. So she shifted to a place in the North India. The access to heroin was easy. So he started using heroin, and within 3 4 months of using heroin, he became addicted to heroin. Then mother got shocked because mother is a doctor, and she has through all her contacts brought him to NIMHANS. So then the boy was brilliant. He was very intelligent. He was topper of his class with 12. Then after the unfortunate event of father's death, then he started using this heroin. Then we have treated him for his heroin. He went back home. He started his undergraduation. And then within some time, we told him, see, you have a potential to get addicted to substances. So please do not continue using any of these substances. But he stopped cannabis and heroin, but he continued using alcohol. So within a span of a year, his addiction to alcohol has increased significantly, and he was not able to work at his or study in the college. Seeing all these things, mother could not take. Mother went into depression, and mother is an anesthetist, so she has easy access to all the anesthetic agents. So she could not take all these things, and she died by suicide. So after mother's death, he did not have father, he did not have mother. Then he decided that okay, let me at least now try to become better, and he shifted to again another metro. He was supported by family members for his work, and he was an excellent writer. He was brilliant. He was brilliant in the sense he was an excellent writer. He wrote for a very good series which all of you would have watched. He was a ghostwriter for that series. Uh, then when he went to this metro and he started getting some money, he started experimenting on more harder drugs. So he started taking cocaine. Following taking cocaine for 6 months, he developed psychosis. And after he developed psychosis, what happened to him, no one knows. But in a span of 8 to 10 years, all the things have changed from a very happy family with very topper of the class and getting all these things. Things have changed drastically. And once drugs were there in his life, things moved on from when there is a stress, things went viral or problematic. So this is not just one story. NIMHANS has an OPD of 200, but in an OPD we see around 200, and most of the people, at least 50% of the people, are adolescents and young adults. And if I ask in rounds any of the story, most of the stories are like this. So let's talk a little bit about what these drugs are. Okay, so in my presentation, I will be talking about what are the different types of drugs, what makes substances addictive, and why do people get addicted to these drugs? What are the problem signs? How can we prevent or help people to stop? And in summary, what is addiction? Dr. Aishwariya will be talking more about the harms related to some of these drugs. Okay, so can someone tell what kind of addictions we have in our society, or in India, or in Bangalore, or maybe in Bomanahalli? So I was discussing with some of the people here. One of the hubs for substances is Bomanahalli. We get a lot of people who come from, I think Bomanahalli is nearby. Yeah, too. It's a hub for many of these substances, harder substances in Bangalore. Can anyone name few substances that they know? Okay. If you name, it doesn't mean that you are using this substance. So let's
Everybody here doesn't smoke.
So I think Dean sir has told about two substances. One is alcohol, the other one is tobacco. Can you tell a little more any other substances that you know? Weed, cannabis that we are talking about. Any other substances? Steroids, LSD. So these are hallucinogens. Steroids, people can we have been seeing people who go to gym and take steroids, which are actually not prescribed, and getting into problems because of use of these steroids. So that's another category. Any other form of drug? Mushrooms. So mushrooms are not the general mushrooms. There are something called as magic mushrooms, which are known to cause hives, and these can also be addictive, and they can also create some problems, which I should have been telling. Any other substances that you know? LSD. LSD. Sir has already told. We have to come up with new substances, which the older generation doesn't know. So, what is the popular drug in your Bomanahalli area? Nobody, somebody said. Yeah. Nobody says snake bite. Snake bite. Again, snake venom, and snake bite are again, although they are not addictive, but people experiment on some of these stuff. Any other substance? I think some of the substances which is very common in this area is cannabis, meth. There is something called as IV tapentadol, where you might be seeing people injecting how people inject heroin. So these are the common substances. Alcohol is the most common. Alcohol and tobacco are the most common addictive substances that are available, especially in the Indian context. Then we also have other illicit drugs like cannabis. We spoke about cocaine, which is a stimulant. People also can get addicted to sleeping pills. So especially diazepam, lorazepam. So common name is alprazolam. So people can also get addicted. Hallucinogens are some things that Sir has told about LSD, magic mushroom. These are hallucinogens. Then you also find, especially in people, street children, you will also find people getting addicted to these inhalants. Idex, right? Fevicol. So these are petrol, whitener, dendrite. Yeah. Okay. If you talk to me and if you tell me, I can give you more information rather than talking amongst yourself. Okay, can people get addicted to certain behaviors? Can people also get addicted to certain behaviors? Like mobile addiction, then gaming, pornography, any other addiction? Social media, Netflix binge watching. Sorry? Web series, yeah, Netflix and web series binge watching.
Gambling.
Sleeping too much. Okay. So there are two behaviors like we are talking about alcohol and tobacco. Two behaviors that people can get addicted to are gaming and gambling. Okay. Yeah. So these are the two behaviors that has been recognized as addictive, gaming and gambling. But other behaviors like you are talking about internet, mobile phone, social media, still in the stage of research whether they can be addictive or not, right? So addiction is something, it's a brain changes that happens in your uh, different parts of your brain, right? So whether these things, like for example, you're talking about social media, phone, whether they bring such kind of brain changes, we don't know. But we know that gaming and gambling can bring a lot of brain changes, which can result in a state of brain which you call it as addicted, right? So, what does these addictive substances do? Have anyone has experience using alcohol, or has anyone seen someone using alcohol? Okay, I'll not ask about even in movie. So, what do you see when people use alcohol? Right? Yes. So they get a kick. Correct? Someone has told the term kick, which means that they get a high. Okay. So that is one thing that happens when people use alcohol. What else happens? Correct. So when these substances go into your brain, they make you go out of control. So it causes a lot of change in the way that you think, in the way that you behave, in the way that you act for your emotions. Also, it also changes your motor functioning. So why do police catch you if you are drinking and driving? Because starting from one peg of alcohol, your motor functioning, your reflexes gets impaired. Starting with one peg of alcohol, how you behave with your colleagues or how you behave with your friends gets impaired. So these substances, when they go inside your brain, they bring in a lot of changes with respect to all these functionings, right? And this is also true with certain behaviors like gaming. When you play games, games also bring in a lot of change in terms of the kick, the reward that you are talking about. So that's why people also can get addicted to this kick or reward that happens with the gaming. Same also happens with gambling, right? So that's why these two behaviors are also considered as addictive. So let me ask you the question that we are talking about is about the kick. So how does this kick happens? In brain, we have something called as a reward pathway, right? Someone gets first mark in the class, so you feel happy, right? If your professor praises you, you feel happy, right? And you got a new car, or you eat a good ice cream, or you go for a run, you feel happy. How does this happiness comes in? Because in brain there is something called as a reward pathway, where the dopamine gets released, right? So what happens when you use these substances? When you use these substances, also this dopamine gets released, but this dopamine gets released much more higher compared to the motor rewards that you get. For example, you go for a run, you put all the physical activity and you run. At the end of the run, you feel, आज तो मजा आया. So that kind of feeling you get, no? So if you have to get first in the class, you have to study hard, go on year, and at the end of 1 year, you get that high. Oh. But that high requires a lot of effort, lot of pain, lot of hard work, and all this. But with these drugs, you get this reward very quickly. So brain also gets cheated by these drugs. When you use these drugs, you get a reward. After a weekend, then you feel that okay, this week hardly we have work, let us get a reward. So then, over a period of time, these substances hijack this reward pathway. So the other kicks that you get from your regular life, for example, every weekend you are drinking alcohol, other rewards doesn't seem much more comfortable. You will be waiting when the weekend comes, when I go to the bar, when I drink alcohol, right? So the other rewards take a lesser stance in front of the drugs. So how does this people starting using drugs occasionally goes into a dependence pattern? So initially you start with a recreational, once in a week, once in 2 weeks, once in a month with friends. Then over a period of time, your brain keeps telling that okay, weekend is coming, let me have one drink because all my friends are going. So that's where you are craving the alcohol. Then you start using it mid of the week, where earlier one peg of alcohol used to give you a high. Over a period of time, one peg will not give any high because your brain got used to it. So you generally increase from 1 peg to 2 pegs, 3 pegs. Same happens with cigarettes. I'm giving an example of alcohol. Same happens with cigarettes. You smoke one cigarette, initially one cigarette a day is doing the job. But over a period of time, you need 5 cigarettes per day, then it goes on to 10 cigarettes per day, then it goes on to 20 cigarettes per day. So class is going, but you still wanted to go out and smoke cigarette and come. Because over a period of time, you also start getting withdrawals. If you don't use the substance, you start getting withdrawals. Weekend aaya, daru piya, next day you have a lot of gastritis. Still, you still wanted to consume alcohol because your brain tells there is a lot of reward. Although you are having some problems, you are having gastritis, next day you are not able to do. So this is something called as use despite harm. So there is a harm that is happening, still you continues to use alcohol. So when people become dependent on alcohol, what happens is that people lose control over the substances that they take. So this weekend, I have an important engagement that I have to give exams, but I find it difficult to control the initiation of alcohol. Okay, chalo. I have taken alcohol on a Saturday evening. I decided that I am not going to drink again on Sunday. But that alcohol use continues. So there is something called as a loss of control that happens, and which is one important sign of addiction. If someone develops or someone feels that they are developing this loss of control, which means that they are going into an addiction with these substances. Either loss of control in terms of initiation, loss of control in terms of termination of using the substance, right? The other important thing that you need to recognize if you are getting into addiction is, although there is some harm that is happening. For example, you went to a physician, and the physician told that your liver is getting damaged, but still you continue to drink alcohol. You went to a doctor, and the doctor has told that your cough is getting worse because you are smoking cigarettes. Still you continue to smoke cigarettes. Then that is a problem, which is called as use despite harm. So these are some of the symptoms that you will identify when this addiction state develops in your brain, right? So why do people get addicted to substances? What do you think? Anyone can tell me? Is it problem with the person? Is it problem with the drug? Is it problem with the family? Is it problem with the friends or society? Is it problem with the industry, alcohol or tobacco industry? Is it problem with the government? What do you think? The problem is the person. Sorry? Friends, the problem is with the community in which you are living in, correct? Right. Any other? Sorry? Yeah, in this adolescent age group, it is predominantly the friends, the problem. Any other thoughts? Why do people get addicted to this substance?
The brain keeps changing.
There is a problem with the brain also. Right? Being idle, so not having work or being unoccupied, loneliness. Yeah. Stress. Mental health problems, having mental health problems can be okay. Self control. Yeah, so it could be because of the cultural factor. It could be because of the cultural factor. Right? Stress because of the loss. Right? So, yeah. So as I told you that these are all the factors that could make people get into addiction. Right? Let me. Yeah. So at an individual level, I was telling about problems with the brain. So to give an example about problems with brain, if you have a family history of addiction, then you are at a higher risk of getting addicted to these substances. You are at a higher risk of experimenting on these substances. Why? Because if you have a family history of addiction, which means that in your brain, there is something called as, we talked about the dopamine, which is a reward, you see. So those receptors, how it responds to drugs is something different. So that is what we have been researching at NIMHANS to look at what is the difference in these brain receptors, how they perceive drugs, right? So if you have a family history of addiction, how your brain reacts when you take this first peg of alcohol is going to be different. And people who have family history of addiction are at a higher risk of developing addiction. Then, in a class, you see out of 100 students sitting in class, at least 5 of them are naughty. Maybe 10 out of them are naughty. And when we did some research on these children who are naughty, what we found is that these 5 or 10 children are children who has problems in terms of their brain development. So we identified that these are the children who have something called as ADHD, attention deficit hyperactivity disorder, which is a treatable condition. Because of this condition, they are not able to sit in class, they are inattentive in class, they are impulsive, they are also hyperactive, which resulted as being naughty. If this naughty behavior is identified, is recognized and treated, they would not have gone into addiction. But if this naughty behavior is not recognized, so they get kicked out of the class. Once these 5 people, when they get kicked out of the class, when they go into the community, these are the people who start using this drug. Because already their brains are hyperactive, their brains are inattentive, so they need something to calm themselves. So the easy access to them, because they are not recognized in the class, they are only recognized in the drug using community, because they are very hyperactive, impulsive, right? So we identified that people who have this vulnerability in the form of ADHD or someone has told about mental health problems, these are also at higher risk of experimenting on drugs and getting addicted to drugs. Apart from that, we also now know that we were talking about the genetics. So we are born with a genetic structure. I have a father who is alcohol dependent, which means that my brain is going to respond in a different way, right? But when I am growing up, when I get exposed to some form of adverse childhood experiences, like sexual abuse or physical abuse or some form of trauma, my epigenetics get changed, and how my brain or my body get respond to these external environments is also changed. Because of that, also people get addicted to these substances. Right. This is something very important. As I was telling that 12 to 25 years is a age where a lot of brain changes happens. Your brain is maturing such a way that it is preparing you for the real world scenarios. So what kind of changes happen during this period? First thing is whatever you have learned during this period. For example, you are very good at music. So the brain invests on the music part of the brain. It makes that center stronger. Whereas you are not interested in driving and other things, the other part is kind of excluded. So this we call it as synaptic pruning. But during this period, if you use these drugs, then brain strengthens the part of the brain which is related to drugs, and the chance of you getting addicted to these substances also increases. Second thing that happens during this period is you would have seen, or maybe older people also would have, if they think back, adolescence is a period where you are also more impulsive, where you tend to take decisions quickly. You are also emotional. You are also artistic during adolescence. But as you grow older, what happens is that impulsivity comes from. There is a reason for that. The reason is that the brain maturation, when the brain matures, first part of the brain that gets matured is this impulse, the emotional part of your brain gets matured. The last part of the brain that gets matured is the front part of the brain, which is a brake, which is a cognitive part of the brain. So adolescence is like if you consider adolescent brain like a car, the motor is matured, but the brakes are not matured. So there is a lot of energy, there is a lot of drive, but the brakes are not yet matured. So that is the reason why adolescents are impulsive. When you are already impulsive, when you start using the drugs, then the front part of the brain that needs to be matured doesn't get matured by 25. So it gets delayed. And the chance of you getting addicted to this substance is also high. So that's why adolescence again I am extending up to 25, 1 to 25. Because 25 is the age where your brain maturation is going to stop. So whatever you want to learn, you have to learn before 25, because That is the period where your brain is eager to learn. After 25 also you can learn. But whatever you want to learn, if you learn about drugs, that is going to last longer, because if you learn about other things, that is also going to long laster. But if you learn about drugs, it's going to long laster and it's going to cause a lot of problems. Okay, so all of you have told, why do people get addicted to drugs? One of the reasons is because of the peer influence, because of the availability. So if there is a lot of availability of drugs, that is also another risk factor for people getting addicted to drugs. And for example, if you are not using drugs, you can get bullied, and bullying also can lead to a lot of emotional trauma, and that also can lead to use of drugs. So we were talking about, we were also talking about the industry. So in India, if you see the prevalence of alcohol use, out of 100 males, 10 males use alcohol or get problems because of alcohol. Whereas it comes to females, it is one. Out of 100 women, one will use alcohol. So for a marketing industry like alcohol industry, the target is women. So if they wanted to sell more, they wanted more women to use alcohol. So how do they promote women using alcohol? Is through your social media advertisement, right? So if you see all these advertisement, for example, in the last part of the advertisement, it is like, if you have to have a good cordial relationship with your husband, use alcohol along with your husband, right? So that's the ad that is shown, right? So they wanted to increase women using alcohol. They wanted to increase women using tobacco, right? So it is promoted in social media with a hashtag called as drink responsibly. So the industry invests a lot of money paying to them, so that if they show that women are drinking alcohol, which means that they are normalizing a behavior, right? So that's how they try to sell alcohol. So you using substances is not just based on your genetic makeup, not just based on the substance. It is also influenced by a lot of industry tactics. Again, you see all these movies. Okay, before every movie starts, the tobacco industry and alcohol industry goes and talks to the producer and the director. Can you increase the uh, length of the scene where the hero is smoking or hero is drinking alcohol? Because the direct marketing of tobacco and alcohol cannot happen in India. So all these things are surrogate marketing. If you have seen IPL, there is a lot of ads for ilachi. So who will sell ilachi? Who want to buy ilachi? So it's a sorry. So it's a surrogate advertisement for Putka, right? So in the same way, you are influenced without your knowledge by the industry. Both alcohol industry and tobacco industry, they are very smart. They know how to target you. They know how to target the adolescents, so that, as I told you, whatever you learn during the adolescence period, it is going to stay for rest of your life. So if they are able to catch you young, so you are going to be loyal for them for rest of your life. So that's the industry tactic. So that's why their tactic is catch young. Okay. So as I told you that there are some risk factors, there are some protective factors. Let's see what are the protective factors. If you have a supportive parenting, if you have a healthy school and college environment, that is a drug regulated environment, if there is something called as adequate life skills, if you have good life skills, which I'll be talking about a little bit, then you are at a risk, you are at a lesser risk of getting addicted to these substances. So what are the problem signs? When you are using substances, if you see any of these changing behaviors in the form of aggression, for example, if you are using substances and you are getting aggressive, if there is a social withdrawal because of using substances, if you are withdrawing from friends and family, also if you are sleeping, eating patterns change. So these are some of the changing behaviors. And if there is decline in academia, if there is also poor interest in your favorite activities, and if you are also having harms, if you are having falls because of these substances, or if you are having any physical harms or psychological harm. So these are the problem signs. As I also told that loss of control, if you are seeing any loss of control, then it's a problematic sign, right? So how can you prevent yourself from using these substances? One important way at an individual level is getting these life skills. So what are these life skills? Anyone? Any idea what are these life skills? Like, any idea? What are these life skills? No. Oh, so some of these life skills are these sorry, madam.
Social.
Correct, correct, correct. So if you have some of these skills, right? So the chances of you experimenting on these drugs comes down significantly. Interpersonal skills, negotiation skills, refusal skills, being assertive, right? Being empathetic, also able to do a lot of teamwork, able to have decision making, critical thinking, coping and self management skills. These are certain skills that as an adolescent you learn. Where do you learn these skills from? One, your parents. Two, your teachers in your school or college environment. The curriculums right now are changing in such a way that you develop some of these skills. For example, decision making skills. Why this is important? For example, someone has offered you substance. If your decision making skills are not adequate, then the chance of you using substance is high. Coping skills. If there is a failure, you have seen in the first scenario that we spoke. When there is a failure, if you are using substances as a coping mechanism, then the chance of you getting addicted to this is high. So that's why these life skills are important.
Interesting to see advocacy.
Yeah.
Advocacy against drugs or advocacy general.
Advocacy in general. So, for example, being advocate or being a leader brings in a sense of responsibility. Once there is a sense of responsibility as a leader, the chance of you using substances also comes down, right? There are other things like we spoke about ADHD. If you are able to see what is the vulnerability why this person is using substances, if you are able to identify and treat that vulnerability, young, a child has ADHD, if he is treated early, if recognized and treated early, the chance of he at the age of 17 using substances comes down significantly. Right? At a community level, parents also needs to understand how they have to support and understand what adolescents are going through. So parent education is also important. Drug-free environment, especially in a school or college setting, having drug-free environment because this is the environment where the industry, the nexus, or the drug cartels try to target is surrounding the schools and colleges, right? So it is also very important to have drug-free environment. Again, it is at a policy level. Then, as I told, that industry influence on people should come down. Government is trying, but again, there is much more that you also need to be aware how industry can influence you. So there are very good treatments that are available. For example, someone is addicted to substances, there are very good treatments that is available. For example, if you have withdrawal symptoms, for example, you are smoking 10 cigarettes per day and suddenly you stop smoking, then you can face withdrawal symptoms. So there are medicines that are there to help people to quit tobacco, alcohol. People when we were talking about the craving, the urge to use substance. So once you stop substances also, because the addiction component of the brain is still there, then you can have the urge to use substance. So there are medicines to help with that. Apart from medicines, there is also counseling, therapy that is available. Not just if someone decides to stop, there is help to prevent them from going back. If someone is not at all decided to stop, to motivate them also, there are good therapies that are available.
So withdrawal and cold turkey has taken.
Withdrawal untreated goes into cold turkey. Withdrawal treated, there are good medicines to help.
So this group therapy like Alcoholic Anonymous.
Yes.
And so on, are there anything like that equivalent in drugs?
So for drugs, there is something called as narcotic anonymous. For tobacco, it is nicotine anonymous. For gamblers, it is gamblers anonymous. So there are group therapies like that. So if I have to give a brief summary of what this addiction is, I was discussing with sir also, and we were also having a kind of discussion. So there are two, as I told about the trajectory, people start with recreational, then get into dependence. So dependence is a brain disease, this is treatable, and it is also preventable. Like because I was using the term disease, it is a disease like diabetes and hypertension. So like diabetes and hypertension, how treatment is available, for addiction is also treatment is available. Okay, so people start with impulsively to get a high, but over a period of time it becomes compulsive, which means that they need to use this drug, right? Despite having harm, despite losing control, they get into this phase of addiction. So there is a help that is available. So with that, I think I will end my presentation. So we have this something called as NIMHANS, which is located at NIMHANS, which is a toll-free number 14416. There is counseling service available 24/7, not just for addiction, but for any mental health problem. So 14416 is a NIMHANS number. You can also visit our Center for Addiction Medicine website to see more information about some of these drugs, what kind of help that you can offer. At NIMHANS, we have 3 days of OPD on Monday, Thursday, and Saturday. If anyone would like to seek help for not just for themselves or for their family members. With this, I'll stop here, and maybe after Dr. Aishwarya's presentation, we'll take questions together. Okay, thank you.
Hi.
Now you need.
Hi. Yeah, hi, I'm Dr. Aishwariya. I mean, this stage is set by my prof, so there's not much for me to discuss, but I think there's something we need to address now, which is the elephant in the room, right? Why not do drugs? Why should we even consider taking help, right? So I know that a lot of you might already know about some harms, okay? So I'd first like to check in on that, and then maybe I can expand on it. So I know there are a lot of people at the back. So I was wondering if we could like take some answers from the back, middle, and then front. Works? Okay. And I can very much come there, so don't make me annoy you. What do you think are the harms associated with vapes? Do you guys know vaping? You know about vaping? Okay. So people at the back, do you know what vapes can do? Do you know any harms? What do you think? Cancer? Okay, great. Great. People in the middle, anything you know about vaping and why we shouldn't do it?
Reversible lung damage.
Okay, great. So, okay, when you meant cancer, you meant cancer anywhere, and I agree. And then there's lung damage. Anything else? Okay, I think that's all right. What about alcohol? What about alcohol? Great. Anything else?
Brain damage.
Brain damage. Great.
Destroys the family.
Destroys the family. Yeah, for sure. So harms aren't just physical. They're not just physiological. They're also to do with the, life around you. They can be personal, right? All professional. Any other damage, do you know, which alcohol could cause? Have you heard of pancreatitis? People getting problems with their pancreas because of alcohol? Right. Okay, let's do cannabis.
I also, noticed that with some of my colleagues in Navy
Yeah,
had alcohol.
yeah,
And people always associate with other things, say gutka or
yeah,
smoking. It didn't isolate itself to one thing.
yes.
So there seems to be a compounding effect.
Absolutely. And like Dr. Narasimha was just talking to us, about the case scenario also that he presented, someone who started very early, someone who's, tried various substances at various time points in their life. So sometimes, these substances don't come alone. Sometimes they come in pairs or even more. Right? So let's try cannabis, weed. Any ideas what it might do? I mean,
Short-term memory loss.
short-term memory loss, great. Anything else? Heart damage. Heart damage. That's great. Yeah, that could apply to alcohol and tobacco as well, I guess. Anything else? No idea about weed. What do you think? So weed is mixed in with tobacco very often, right? So I mean, in that way, it has, like so was saying, a compounding effect sometimes. You get a double whammy, cannabis and tobacco both. So I'm going to be talking a little bit about.
I also think what is very important for young people is that substance abuse can cause serious personality issues. For example, it could impact your resilience. So, so, so that's what when the Americans were in Vietnam, they actually used drugs as a weapon to lower resilience levels of the American soldiers.
And in that way, you know how Sir was talking about how people who make sometimes impulsive choices get into this circle. The impulsivity increases as their substance use increases, because it affects the brain. So of course, the other parts of the brain are going to be affected, right? So what they don't tell you sometimes when you're just starting off substances, they might tell you weed is totally natural. It doesn't cause much of a problem. It's actually very beneficial for you. I don't know how many of you heard that. There's another myth that tobacco is quite prevalent and it doesn't cause too many problems. Recreational drinking is absolutely fine. So I want to tell you what they don't tell you.
Alcohol, they say wine is good for heart.
Wine is good for heart, precisely. Yeah. So there's a lot of, it lowers the risk of dementia and there is a safe limit, etc., etc. So there's a lot of info going around. Some of them are good, some of them not so well researched. So maybe we can talk about what your peers might not know, right? Okay, so Sir's already told us why people start substances. It could be because it looks cool. It could be because your friends are doing it. It could be because you have way too much stress. And I'm talking precisely from a college point of view, right? And it could also be because you're curious, right? You might be like, okay, everyone's trying it. Why shouldn't I try it? They seem to be having fun. Yeah. And you already know what it does to the brain. Now, because we've talked so much about the reward pathway, the substances aren't going to just go and hit there, right? They're going to affect the brain as a whole. And eventually they're going to have to get pushed out of the body. So they're going to get metabolized somewhere. It can be the liver, like you guys said, it can be the kidneys. No. And then to get that hit, to even get to your brain, they have to actually go into your bloodstream sometimes, right? And because of that, they can affect all other organs in your body. So my surgery professor used to tell us, because there was so much to study in medical school, he used to tell us, if you don't understand what to write and if they ask you what alcohol can cause to your body, you can name any cancer, alcohol and tobacco both. You can name any cancer from the top of your head to the bottom of your body and you'll be right. Right? So you can say skin cancer, you can say breast cancer, you can say ovarian cancer. And he was absolutely right. Right? There isn't a single part of the body that doesn't get affected by these two agents. So what can actually happen over time? Someone mentioned short-term memory loss, but you can also have memory loss in general. People experience difficulties in concentrating. So imagine people who already had inattention getting into this, getting sucked into this, and then having further problems with attention. What happens over time is because they are not attentive, they stop going to school. When they stop going to school, they get even more into bad company of people who aren't in school. And then it's kind of like a vicious cycle. Then they're not getting jobs, etc., etc. So it can affect you in many ways. This is how it can affect your body, but it can also affect your life in general because of these problems. It can have mood swings in people because they're in withdrawal, they want to get out, they want to do the drug, right? It can cause anxiety, a lot of it actually. So most of the agents have been known to cause de novo anxiety. They never had anxiety issues in their life, and now they're developing anxiety, developing depression. It can cause poor decision making because drugs make you feel that way, and of course, materialism. Right? So, Sir was talking about the earlier you start, catch them young. That's their slogan. But we want to prevent it young. So, the earlier you start, the higher the risk of long-term harm. So, we say that people who are in their, 20s, if they can delay the use of substances, there's nothing better than that because the brain learns over time how to make better decisions, right? And repeated use can actually wire your brain in ways that can be very, very hard to undo. So 6 months of use, a year of use can actually do some damage to your brain that you didn't know originally, right? Do you guys know about injecting drug use? What do you think could be the harms associated with that?
Infections can happen.
Infections can happen. So you can have HIV, we have hepatitis C, hepatitis B, syphilis, right? And other bacterial infections because, it's not very clean the way they're doing it. Anything else?
Overdose can lead to death also.
Absolutely, overdose can lead to death. We have a very big problem in Bangalore known as Tidal. I don't know if you guys have heard of it. It's a tablet which people are injecting and it's causing a lot of deaths. It's causing a lot of infection, it's causing heart disease, and it's quite prevalent. So if you know someone or have heard of this, then you can always get them help because it can be quite fatal to have an IV drug addiction problem, right? Okay. So yeah, this is the popular myth, right? So weed is natural, but we know through work, research, and clinical practice that it can actually trigger psychosis. We know that everyone drinks and vapes, so it's hardly a problem. But now we know that it can actually lead to heart disease, cancer, and long-term addiction. So it isn't as normative as we sometimes believe. We sometimes think that a lot of people are doing it, but when we actually check the percentage of people doing it, it's still low, thankfully. So sometimes these norms can affect the way that we perceive something. Someone's offering it to you, you might think, yeah, if my friend is doing it, then it's pretty okay, right? I can also try it. But you never know how it's going to affect your life. So what we see at our clinic is a 16-year-old boy dropping out of high school because of drugs. We see 19-year-old girls in the ICU because of an episode of binge drinking. We see a university student losing a year of college because of a case against them because they found some drugs on them. We find a 20-year-old, and I'm not even exaggerating, it's quite sad. We find 20-year-olds who have hepatitis and HIV after injecting drugs. And now what's happened is that they're not getting jobs, they're not getting partners, they're not sure what to do with their lives. And they are very brilliant people. So many a times we tell their families that, your boy is not the problem, the agent is the problem. We need to get him out of this. Okay, this cycle, we need to get him out of this. And once he's out of this, all of his previously known strengths and abilities will help him forward, right? Because they aren't bad people. They're just people who made bad choices. Okay, and they can actually make better choices going forward. So this is actually available everywhere online. So this basically says that marijuana is not as safe as we used to think it is.
Can I?
Yes, sir.
Can I play devil's advocate?
Okay.
What works with me is to say they are bad people, don't be like them.
I guess. But from a clinician point of view, what I might see that as is them thinking that they are an alcoholic. I would like to say they have an alcohol use disorder.
That's for them. But
Correct.
if I want to make an example of them to say other people, like my students.
But if I can get even one student to come and seek help for their problems, I would have made lives much easier for everyone around. So I think it's both, but I would never blame the person. I think there's so much going on. We just studied about why they get into it and how they do that. And over time, when to be honest, when I was in MBBS, I hardly saw it this way. Okay, and I was a 17-year-old fresh into medical school, and I thought, of course, people who are alcoholics are horrible. They should be they're causing a problem in their family. They're beating up their mothers. That's their choice. But as I got more and more acquainted with people with addiction, I'm realizing now that it is equally our responsibility to treat them. When we treat them, we treat their entire family and we treat their community, and they actually become people that you would not imagine. They become university professors, they have children. So it's worth seeking help for. Okay.
Fine.
Yeah.
So the 200 OPD that I'm talking about are not people who are forcefully brought by their family members. So these are the people who themselves have come telling that, sir, we wanted to stop these substances, please help us. The reason why they are not able to stop these substances is because the disease has set in where although they wanted to stop, every year someone who smokes cigarettes, they try at least 8 times in a year to stop their cigarette. But they don't know how to stop it in a right way. So that's why they find it difficult to stop. So with adequate help, it is not that people who use these drugs They don't know that these are the dangers that are associated. Initially, they would have started off with a impulsive thing to get a high, but over a period of time, as this addiction sets in, it becomes compulsive, and despite people wanting to come out of this, they find it difficult to stop. Right? So the point here that we are trying to make here or convey is that people who are using drugs are not bad people, right? Because their brains have changed in such a way, the brains have rewired. We call this term as rewiring. So the rewiring happened because the drugs went into their brain and the brains have got rewired. And there is also a group of people who are born rewired, right? So which are we call it, we are telling about ADHD people, people who have ADHD. So their brains are differently wired compared to people others. So they are at a risk of experimenting on drugs. They are at a risk of getting addicted to drugs, right?
And also, if I have 15 inpatients under my care, 14 out of them, if not all, will tell me that I really don't like my drug anymore. I don't like using alcohol. I really want to leave it. But I'm not able. So it gets to that point. And if we can actually stop before they get to that point, then things would be, ridiculously different in their life, right? And I think it's important for us at this stage not only to know this for ourselves, but also know it for the rest of our lives in case we encounter people like that.
Medicines which will stop them from taking.
Absolutely, absolutely, we do. And a lot of people have,
Hating them.
in a way, yes, because they start loving other things in their life. They start to find that breather, that space to actually go do something else, finally find a job, have a routine, get their families in place, and then they have so much more in their life. So it's not just about subtracting the drug from their life, but also about adding valuable things into it. Okay. So yeah, marijuana can definitely reduce your IQ points. Okay. And people who smoke are actually 3 to 7 times more likely to be involved in a car accident. So ideally, you're not supposed to drive for 72 hours after a smoke. Users are much smoke of marijuana. Yeah. Users are much more likely to drop out of school. 1 in 6 teens who try it will become addicted. This is quite important because everyone thinks I'll try it, but then I won't be addicted. Like other people get addicted, but I won't. I want you to know that addiction does not, attack a certain type of person. Perhaps some people are at higher risk, but it can affect anyone at any age in any profession. So the more we are aware of it, the better we can, kind of lead healthier lives.
But why is it being legalized in some countries?
There are debates to that. I think we still stand that it should be illicit. And I think, for our country, we're still at that point.
The argument there is that it is not that it is useful, that's why they are legalizing it. Most of the countries are decriminalizing it because the amount of money that is spent on policing and trying to drug enforcement agencies, the amount of money that is spent on that, and the deaths that are happening among users. So at a public health level, the impact that not decriminalizing cannabis has is at a higher in some countries where it has been decriminalized. But in India, that is not a situation. So to get a public health level that people have taken a decision that we are going to decriminalize, not just because it is useful. Definitely, there are components of cannabis that are used in medical research, but people don't take cannabis for the purpose of those usefulness, right? People take cannabis for purpose of getting high. But the components of cannabis, definitely, we also use some of the components.
Has there been any research say where it is legalized, there are less addiction where it has not been?
So, for example, Dr. Aishwariya was telling about the accidents that are happening. So there is a lot of research from Canada that is coming up after the decriminalization and legalization of the recreational use. The number of accidents, earlier it was road traffic accidents because of alcohol. Now there is an increased number of accidents, road traffic accidents because of cannabis. So alcohol, it makes people drowsy, disinhibited, and they drive fast. Whereas in cannabis, it makes people stoned and they drive slowly, where they were supposed to drive at 100 kilometers per hour. They're driving at 30 kilometers and they get into that. So that is the difference coming up from countries that is decriminalized or legalized.
So I think, I'm sorry, I didn't understand. So you did not necessarily say that decriminalizing has helped.
No, it's not. So decriminalization helped in the angle of the amount spent on drug enforcement. That amount they are not able to. They have saved that money, so they need not police and do all these things. For example, you take an example of Bihar, where the alcohol is banned. So after banning alcohol from 2016 onwards, so one is the illicit this thing. There is also a lot of people in jails is filled with people who are using alcohol. Whereas in Karnataka, people who are using alcohol are on doing that regular thing. But in Bihar, if you use alcohol, you are in jail. Right?
They are spending more money.
More money in terms of policing. So that is one angle of it. But on the other angle, there is a recent research that comes from Bihar that the domestic violence on spouses has come down significantly after the. So where do you balance between two components? One is there is an increase in enforcement. There is also this skill. So that is a debate which is taken at a policy level by the government.
Decriminalization sometimes makes people want to seek help more, right? So if something is illicit, sometimes they might feel that, I can't tell other people about it, what if I get caught, etc., etc. But when you decriminalize certain health sectors, they feel that perhaps people will seek treatment more rather than being very punitive. So this entire population will get diverted to the judicial system, whereas they should have been in the medical system because they're more likely to use substances even in prisons and recommit crimes when they're out. So actually, treatment and rehabilitation is more important than punishment and just locking them up because that will solve the problems on a larger scale. I think that's one of the debates that's all right.
Because of decriminalization, it is also availability has also become rampant.
Yes.
So
there's always like three sides
but
to the.
it's available, more people will not be tempted because it's not available. People are getting.
Again, sir, I
You
think
literally
there's two
can't.
sides to it.
So again, this debate generally is taken at a public health policy level, where they weigh the benefits for a particular country. So what is applicable to US and Canada may not be applicable to India because it also depends upon how much India is spending on drug enforcement. It's a very minute amount.
So I was talking about underage drinking, and 40% of passengers die in a car crash when they are when they are in a car with a drunken driver. Right? So I don't know how many times you've been in that car, but I'm glad you're here. Okay. 5,000 die from alcohol related injuries every year. And these are injuries and not even the cancers and things we were talking about before. Very likely to have academic failure, more likely to use other drugs, including illicit drugs. Okay. Because they get into that company which tries other things, more likely to have addictions later in life. And 1,89,000 people visit the emergency every year. This is a statistic from outside, but I can tell you what I see at NIMHANS. In 1 year, when they did a review of how many people came to the psychiatry emergency, so this isn't even a big emergency, this is psychiatry emergency, 55% of them were from addiction medicine. So they were actually, people who kept visiting the emergency room for one thing or the other. Right? And like I said, it can have neurologic effects on your lung, muscle, pancreas, bone, your entire gut, the liver, and also in your heart. So there are harms wherever you see, to be honest, right? And cancers aren't even included. They've put it at the bottom. Right? I want to talk about e-cigarettes because I think they're becoming more and more prevalent now, right? So e-cigarettes are electronic devices. You can charge them. They come in really fruity flavors. They're quite appealing to the youth because you don't have to, smell bad after you have a smoke. You can do it anywhere, right? And that's why they've actually marketed it to people of, in the 20s age group. They've even younger. So they've said that this is much better than smoking. It's actually much safer than smoking and it's more appealing than smoking and it won't cause cancers. But now we know that it does. It very much causes lung injury and it can cause all of the other effects that smoke can have on your body, right? The most important thing I think we want to leave you with is that you deserve a good life. Everyone does. And because, Sir was talking about highs that you can chase, which also spark your reward pathway in the same way that drugs do, but require a lot of effort. I think they provide you more meaningful rewards in the end, right? More substantial rewards, and they're safer rewards. At the end of the day, they're more satisfying. It may not seem like that right now, but they are, right? So ask questions always. And if you feel stuck, never ever feel like you can't talk to someone, because nowadays we have avenues where you can talk to pretty much a mental health expert anywhere, right? So I don't think that you should ever feel that you're alone, because sometimes people who use substances feel like that. Even though they have drug using peers, they feel like that. Okay? So if you think that you ever want to talk to us, then you can reach out, like Sir said. And you can also look at more information. I didn't want to bombard you with cancer stuff. So you can also look up more information on our website. And if you have ever someone, or if you smoke tobacco and you want to quit, this is our tobacco quit line service. We also have a QR code if the people in the other room have questions which they can't directly ask me. So we'll display that QR code. You just have to scan it, and it'll be anonymous. So I mean, you don't have to raise your hand. But do you have any questions? I will. Do we have questions here? If you want to address, direct them to Dr. Narasimha. Yeah. Um,
Part of direct close to I'm part of direct close to Uganda. And when we did research to why youth or teenagers doing alcoholism and smoking, realize that some of them doing it because of esteem. So because they're in class, they can present and their friends are being down on them, professors are trying to, so they become uncomfortable to the society and they try to take these drugs so that they can feel confident. So I'm requesting more elaboration where students are taking drugs because of confidence issues. I'm also requesting for more clarity, or if research confirms that people that join drug use or people that get addicted, it has something to do with their personality, or maybe an introvert and I'm scared. So because I want to feel like the rest, I end up joining. Yeah, absolutely. And also being a father to people that relate with them most in the society. If I have a friend that is addicted and I'm not, how do I relate to that person and how do I find myself to?
That's great. All three great questions. I think the first one was about self-esteem. So a lot of people initially start taking substances to feel more confident. Classroom settings or in professional settings, it all comes to what they expect out of the exam. Okay, for some people, it could be to be more relatable, they want to be sociable, agreeable, they want to not say no to their friends. For some people, it could be because they're really anxious and they are struggling to find the confidence to go up on stage and talk, right? And we've had all kinds of people with all kinds of expectations coming. I think when that problem comes, part of what certain their lives do with it. Because if drugs are filling a hole or serving a purpose in your life, okay, which can be served by something else, some alternative. I think addressing that is important, right? So I can just give them a pill and say, okay, now you can stop using drugs. They won't have a drug. That won't solve the problem. I need to actually help them with their self-esteem. I need to actually get them some peer support or a network that can help them grow. And only then will that, that hole that drugs had filled, will it get filled with something else? The second question was about personality. Definitely some personality types are more at risk. So I was talking about people with ADHD, they have externalizing temperament, because of which they are more likely to take risks and search for something new and try something new. But they also have personalities like you mentioned. I'm very shy, I'm very introverted. I would like to say in general that any type of personality could derive some kind of expectation from a substance. But it's important to address their vulnerability. What made them vulnerable to substances? And then we could actually uh forget to
And I don't know what, so for example, it's a 10-year-old child and he has been bullied at school or he has been he has been bullied at school or he has been insulted at class, say 10-year or 15-year-old child. And once he goes back to home and he wanted to discuss with his mother that I have been subjected to bullying or I have been scolded. And if the mother or father are not supportive, right? Then what happens is his self-esteem gets affected because on day in and day out he has been insulted. If he went and told to the teacher and teacher doesn't take any self, right? So obviously his self-esteem gets affected. What parents or what teachers has to teach to the child is how do they handle when such kind of insults happen. So that's exactly we are talking about life skills. How do they cope with someone insults them? If that is not taught to them, these life skills are not taught to them. The easiest way, for example, I told to my father did not address. I told to my teacher did not address. I went to a friend told, hey, chalo, let's go and have alcohol, let's smoke cigarette. So that becomes an easiest way to cope with whatever the problem that he has, right? But if family members are able to teach him life skills in terms of how to cope, how to handle, right? How to make a decision, how to be assertive and tell, hey, you are not supposed to bully me. Hey, you are not supposed to take me for a ride, right? If the family members are able to teach these life skills, then the problems of substance use will not come, right? And you also need to have good peer support systems. Not a peer support system that encourages you to use substances at the time of stress, but tells you or guides you or supports you in a kind of stress. So these are all preventive things that are important in terms of preventing people from getting into substances.
I also, I don't know. If you do have a substance using peer and you're not sure how to approach that, you definitely think that they have a problem, then I think the best way to do it as a peer is to offer support in any way, right? In a way that they can probably go into a place where they can make better decisions. Because sometimes when our peers use substances, it's hard for them to take our advice. It's hard for them to, tell us about these problems. So if you feel, first off, take care of yourself, okay, because sometimes it can be very overwhelming to have a peer who's constantly getting drunk, constantly getting into trouble. So if you have that, then you need to take care of yourself as well. But find them an expert if you think that this is something that's beyond your, right? Because you might think, okay, how can I get their parents involved? They hate me. How can I tell the teachers, that's going to get them suspended or whatever. So in that case, involve a professional and then see where things go. Probably then.
So if I have to add on to that, see, you know that people use substances for a particular reason, right? For example, you told about self, you told about difficulty in coping. So if you are able to identify in your friend that he is using substances because of this reason, so people may not be willing to take help for the substance use, but you can offer that. Why don't you take help for your self-esteem? Why don't you take help for your impulsivity? Why don't you take help for your decision? So reframing the problem that okay, yes, this is the output problem, but what is the input problem, right?
Right, we have some anonymous questions actually. Someone's asked if I consume the leaves of marijuana which are legal in India, then does it have the same impact?
Oh, that's a good question. What you question?
Does consuming the leaves of marijuana legal in India have the same impact?
Right. So that's a good question in terms of bang. We call it as bang, and which is legal in some parts of the country. We call it as bang goli, and it's also part of various cultural things. The THC content in this balm is very, very less. So although it gives a high, but the THC content is very less, which makes it less addictive. Although there are people who can get addicted to this balm also, but the THC content is so less that it makes it less addictive. That's why it is not under the ambit of NDPS, where you will get punished if you are consuming balm goli, and if there are states where you are not, it is also legally available. So there are balm shops that are available. So, yes, the answer to the question is that it is not recommended that you go and consume balm. It is that it is not under the ambit of NDPS because the THC content is less and the addictive potential is also less, and that's why it is also part of the various cultural. Right?
It is very much cannabis, right? So I mean, it can also cause psychosis. We've had people who actually got psychosis, then later turned out that they have long-term schizophrenia from bhang ki goli itself. So you don't know who's vulnerable to get that, right? So it's a bit tricky there for us to say, yes, it's very safe in that way.
So the other thing is that this cannabis is also called as a gateway drug. So people who experiment on this bangoli will not stop at bangoli. They escalate or they graduate to cannabis, marijuana, and from there they graduate to other drugs. So this is called as a gateway drug, right?
There are questions about how there's a key mechanism. So some people have asked to smoke and drink for several years but still have a long lifespan. And how come these are illicit substances? How do they actually contribute to substance addiction? Because alcohol and tobacco are illicit. Yeah, sure. I would like to say that, if let's say this, not all graduate degrees have a job right now. All people who have jobs have graduate degrees. Does that make sense? Okay, so it's just because someone has not been impacted by, these kind of health problems would not necessarily mean that all people who are using these substances will not be. If you look at the statistics, the odds are actually in the favor of you actually getting a problem. It's not a very less than 1% risk that we're talking about. So I'm happy that this person has, survived for very long and been able to lead a successful life. But unfortunately, we've seen a lot of people who had problems with it and still struggle with it. So I think if someone is struggling with it, they should consider the risks rather than.
No, actually, example, all my colleagues, classmates in naval academy, who took to alcohol, none of them became captain. So by except, and there was no exception. It impacted their careers. Many of them died young. These are all cases where somebody drinks and lives to 90 years.
So there is something called as a bell-shaped curve. So if you are aware of a little bit about the statistics and bell-shaped curve, right? So there might be a group of people who would have made it to 90 years after drinking and something. But overall, whatever the research that suggests is that people who drink alcohol or continue to smoke cigarette, the life expectancy reduces by at least 10 to 15. Right? So if the average life expectancy of India right now is around 75 years, so the life expectancy among smoker and alcohol using population is somewhere around 60 to 65. So life expectancy comes down significantly because of this. It's not about you are okay, I will live till 60 years, until 60 years I have lived a bindas life smoking and drinking alcohol. No, that is not going to happen. Till 60 years, the morbidity is also high, right? It's just not about the death, it's about the quality of life.
And one question.
The sample size is quite low, it's like low. Sorry, to go.
So you can answer those questions. I have a.
Okay. So they also said, how could I help someone who drinks a lot and smokes a lot? I think it's similar to what she asked as well, about how I can relate to a peer and get them help. I think making them aware and giving them a very non-judgmental, opinion. I'm expressing concern. I think it's getting a bit out of hand. Okay. Do you think that is related? And there can be so many different ways to how they might respond to this. They might get really angry with you and stop talking to you. They might say, yeah, even I'm concerned. or they might laugh at you and say, oh my God, you're such a worrier, don't worry about it. Okay, so it can go in many ways, but I think expressing that concern is important and then offering them support in case they want to get help later.
Now you also know that addiction is a disease, right? If you treat addiction as a medical disease, then for example, diabetes and hypertension, you don't hesitate yourself from going and taking treatment, correct? In the same way, if you treat addiction as a disease and treat it as a in hospital with doctor, then the chance of the person taking help also increases significantly. So that's why the help seeking has increased at least in the last 20-30 years for addiction related things, because instead of treating it as a moral stigma or evil, now we know that addiction is treated as a disease in hospitals rather than treated as like someone who is not part of the society.
I think the few questions that they're just yes or no questions. So is sadness a disease? Yes and no. Sadness is an emotion, so we all experience it. It's part of life. But if it gets to a point that's affecting your functioning, then it could be a disease and you should seek for help. And people are asking if 2 months of beer is good for the heart.
So I will answer that question with the things that I have told about consuming 30 ml of red wine per day increases your cardiac health, right? So this was a study that was done in 1930s, where it was done in a cohort of population who were fit, who used to exercise daily, who used to have a healthy lifestyle, who are also very disciplined, in a sense that they could control at 30 ml and not go beyond 30 ml. So when they did a post hoc analysis of that study, what they have found is that people did not have a good cardiac health because of consuming 30 ml of wine. People had good cardiac health because they were also very rigorous with their exercise, they are also fit, they are also disciplined, right? So that study continues to influence practice because the industry has used that study and try to convince people that taking 30 ml of red wine is healthier. So that is about the first study that Sir has spoken about. This beer, 2 pints of beer contains 2 units of alcohol. What current research tells is that consuming even a single unit of alcohol is harmful. For example, a woman drinking 30 ml of brandy, whiskey, rum, gin, which is considered as 1 unit of alcohol, regularly increases the risk of breast cancer. So that is the level of evidence that we have right now, that even consuming 1 peg of alcohol can be harmful. For example, 1 peg of alcohol, so in your gut, there is something called as gut microbiome, right? So the gut bacteria should be in gut, it should not enter your blood circulation. When you consume that 1 peg of alcohol, the gut porosity increases and the gut bacteria enters into your blood. So that is the level of research that we have now to say that even consuming 1 peg of alcohol. Earlier there were guidelines. Men can consume 14 pegs of alcohol in a week. Women can consume 7 pegs of alcohol in a week. All these things is now removed. There is no safe level of alcohol consumption that anyone can consume at this point of time.
But actually, I more fundamental question. I know there are plenty of questions here. I think in Bangalore, every lane has covered more and more of your company, right? So any amount of effort like this, I appreciate that you know, but we demand the institution in our city. But any amount of effort is not going to avoid questions. What is your opinion on that? Because jobs are flourishing more and more. And I think we do know that when the people, young people go to power, there are a lot of things that offer, not only here.
Yeah. So again, there is as you are rightly pointing out, there is an industry. There is a industry which you call it as food and beverage industry fighting with an industry called as health industry, right? So this fight is happening. We are optimistic in terms of whatever the efforts that we are putting are helping. The reason why I will tell you is that in terms of, for example, if you see in 1990s and 2000, public smoking was not low, right? So public smoking was so rampant, and right now Would you see such kind of public smoking at this point of time? No. That is just based on observation. But based on the statistics, if you see the global adult tobacco survey that is conducted in India in 2006 compared to what it is done now, the tobacco usage has come down significantly. So there is reduction in consumption of tobacco.
It's also because of tax system.
Taxes, there are multiple causes. But what the optimism that I am talking about is that there is a reduction.
Yeah.
Right? In terms of alcohol also, we don't have kind of better for alcohol. But what we are seeing is that lot of regulations and also your own awareness. Right? The problems related to, see, always the industry wanted to push, as I was telling, that industry wanted more women to drink alcohol because the percentage is less. Right? We need to come up with some counter measures so that that doesn't happen.
So in Western countries, has use of alcohol come down? Is it coming down? Any research is there?
No, Western countries it continues to be same, and this gap between women and men is reducing. For example, in India, 1 and 10, but in Western countries 5 and 5, equal, right? So what the industry right now is targeting India because they wanted to reduce this gap between 1 and 10.
Unexplored market.
I would just like to say, no one drug is better or worse than the other. There were some questions on whether alcohol is safer than alcohol. It's hard to ascertain, right? Because we all have our own individual risks. If my father has a risk of heart disease and I am using a substance which causes heart disease, then I have a different risk than say someone else, right? And if I have a family history of mental health issues, people have had psychosis in my family and I consume harmfully and have psychosis, my risk is different. So no one substance is per se safer than the others. And if your friends are struggling, I think you guys also spoke about rehabilitation centers. A lot of unofficial rehab centers have opened up. If you feel that there's a rehabilitation center you need to help from, please check their credentials, make sure there are qualified professionals, make sure that they treat people with a lot of dignity, because there are some rehab centers which aren't really rehab centers, right? So research on that, and I would say get help from like a qualified professional for addiction psychiatry, especially if your friends, lot of questions about how do I approach my friends. Look, you've expressed concern and they've negated that concern for now. I think steadying on that support is important. When they get help as part of their journey, you may not be able to push after a point, but it's good that you have reached out, and that's I think a good thing, right?
Yeah.
So what are the consequences faced by the passive smoker?
Yeah. So for example, there is a lot of research in terms of passive smoking and cardiovascular. So, if you are smoking 5 cigarettes at home, okay, and your friend is not smoking, so if you are living in the same room, then obviously at the end of your 5 cigarettes, he is already smoking the 5 cigarettes, right? So that's the risk of passive. Okay, if you are in the same apartment, you are in the ground floor, and your friend is in the first floor. Then if you are smoking 5 cigarettes, it is almost equivalent to 1 cigarette that you are smoking, living, because the smoke feels very suffocating. So that is second hand smoking that we are talking about. There is something called as third hand smoking. For example, you are sitting in this room and you have smoked 10 cigarettes and you left the room. Okay. There is a lot of smoke that gets deposited on this room. And when you enter this room, the third person who is coming is going to take at least half a cigarette because of the third hand. So the cardiovascular risk and other risks are also equivalent based on at least half of the risks you are carrying because of this thing. Especially, there is a lot of research among pediatric children, the pediatric population, where in a house, fathers are using cigarette, mother is pregnant, the mother having a risk of IUGA, which is a growth retardation during time of pregnancy, is significantly higher among houses that has this passive smoking compared to home. And the behavior problems in these children is also significantly higher because of passive smoking. So this is the level of risk that is associated with passive smoking. That's why the COTPA, and other Tobacco Products Act is there in India, is to prevent this second-hand smoking Again, there are also some implementation.
Also have second-hand weed smoking. If you sit in a room where people are smoking weed, you will also imbibe.
Correct. So there was some research in terms of getting urine drug testing for weed users and passive weed users. Right? So when you look into the urine samples of passive weed users, so their urine samples also have some positive, although they have not been using weed. Any other question? Direct question.
Also, you can also visit us, or you can always call if there's any problems, and we are always okay to take more questions personally. I think I'll be short on time, but if you have any doubts, please reach out to us. And if you genuinely feel that someone needs help and they many times they're not aware that there's help available for this, just let them know what you want to do.
Thank you.
Thank you, sir, and thank you, ma'am, for addressing the queries and for your valuable insights. So now that we've gained enlightening thoughts from our esteemed speakers, it's time to witness a skit prepared by our fellow mates. Through this short act, they aim to portray the harsh reality of drug abuse, how it begins, how it spreads silently, and how it impacts not just one life but many around it.
ಒಂದು ನಿಮಿಷ ಅಲ್ಲೇ ಅಲ್ಲೇ ಯಾವಾಗ ಇವಾಗ ಮಾಡ್ಲಾ
So one of my introduction. So I would like to introduce the performers of this skit. We have Veeraj, Sai Kiran, Monish, Anjan, Mervin, Hari, Keshavan, Giri, Asif, and Gokul.
Preview. 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 Preview.
That was not just a skit, that's the reality many face every single day. Drugs may seem like an escape, but they only lead to a dead end. They steal your health, your dreams, your relationships, your future. We all have problems, but drugs are never the solution. You're stronger than your addiction, you're bigger than your peer pressure. You're meant for something greater. Say no to drugs, say yes to life, to family, to hope. Let's choose a future where we lift each other up, not fall into darkness. Like, then I would like you to address it.
Good. Went well. Everybody understood what I'm doing.
So, on behalf of the Prabhav Club and the School of Commerce and Management, I extend my heartfelt thanks to our esteemed guest, Dr. Narasimha sir, Dr. Aishwariya ma'am, and a special note of gratitude to our beloved Dean sir for his unwavering support, constant guidance, and encouragement in making this session possible. Sir, your leadership continues to motivate us to engage in meaningful and impactful initiatives. Your insights have opened our eyes to serious and often hidden impact of drug abuse, and your words have inspired us to be more aware, compassionate, and responsible in our actions. We are truly grateful for your presence. I would also like to thank our management, our hardworking coordinators, the faculty, and non-teaching staffs, and our very enthusiastic students for your participation and cooperation in making this event a successful one. Thank you. So I would like to felicitate them. Sandhya. Ma'am.
So, Thank you very much, Dr. Narasimha and Dr. Aishwariya for being here. And very impressed that they made very serious area of discussion. Easily understandable. This is a problem and in many parts of the country, particularly on campuses, people younger than you, maybe not as educated as you, not as fortunate as you being affected. So at least we have the opportunity to listen to experts like both of them from NIMHANS. I'm also deeply grateful to their organization for allowing them to come here to the university and talk to all of you. And thank you very much. And thank you very much for being here, as well as students in the other room as well. So all of you have a good day.